Hello, everyone. Welcome back to AMC Connects. AnneMarie Czyz here, your president and CEO, and we have a real heartfelt episode for you today. I'm very excited about it, as always. So we have a special guest with us, a frontline leader. I think I promised that on episode 8, and an important announcement in case you didn't hear it. So please stay tuned. Welcome back. Thank you for staying tuned in. Just want to briefly go over AMC Connects if this is your first episode. I was actually talking to a few people out in the community last night, and they were asking, they're not really directly tied to the Rome Health Network, and they were asking if this podcast is live, can they get to it? And of course, as Chuck and I announced when we were coming back for permanent episodes, that we have the feed live and you can get to it by YouTube, and people can tune in and hear a little bit more about what's going on at Rome Health and the level of depth that we have on this podcast to talk about things or to have a meaningful conversation with key stakeholders across the organization. And so we had 6 weeks, I think, Chuck, of a pilot podcast.
6.
And then, 2 episodes ago, we went permanent. And the goal is to be able to give some items that are kind of hot off the press, high priority areas that may be, I've heard throughout the organization as themes that people want to talk a little bit more about, or being able to get to know people with a little bit more depth and get to know me as the CEO. And so jumping right in, and we do, Chuck, we haven't talked about this in a little bit.
Wait, what?
We do have the mailbag.
We have the mailbag.
I forgot
Get to the mailbag.
Yes, please get in the mailbag. If you have a question, that's one of the ways we understand some themes or what's on people's minds. So don't hesitate. We're always looking for, I think our goal is for 3 per episode. We haven't had any in a little bit. But I think Chuck and I have heard from other sources and pathways, like I said, either out in the community or conversations that we're having within the organization. I should have said it before now, but Merry Christmas Eve for those that celebrate the Christmas holiday. And for others, I know the holiday season's kicked off for a variety of different celebrations. And so I hope everybody's having a wonderful holiday season and you're safe and you celebrate with family and things are going wonderful. Again, hot off the press, I shared that one of the goals here with the podcast, certainly, but I believe it was right around 5 years ago, I was doing one of my first employee forums, and employees had shared with me all the priorities that we need to focus on. And it was an amazing meeting, and it really fed into this amazing strategic plan, that big, bold vision we talked a little bit about on episode 8, and I'll anchor back to that in just a minute. But when I left the room from that employee forum, I said, well, if there was one thing, because if I was honest, I was a little bit overwhelmed. I had one of those white sheets of paper, and kind of the entire thing was filled up about all the priorities, and again, very meaningful, but I was like, wow, how can I make sure I serve this great organization timely, efficiently, and meet people's expectations? So then I said, well, if I could just do one thing alone, and like unanimously in the conversation, everybody said, well, AnneMarie, you can communicate. Communicate. We want to know what's going on before it hits the papers or before I'm hearing it from somebody in the community. And we've really tried. Chuck, Cassie do a great job helping me that we get messages out, especially strategic ones that are changing before people hear about it throughout the community. So we tried to do this with this one. I think many people have known for a few years. And again, I said in episode 8, we had this big, bold vision that we've accomplished, and we celebrated last week a number of those milestones. But kind of at the tail end, I said what kind of pushes us into post-2024 and into 25 and 26 is we really have to make sure that we're devoting time, energy, resources to our information services infrastructure. We kind of have lived in a desert for a while. Employees across the board, whether clinical services, support services, our doctors, our APPs, even our patients, tell me that it's really hard sometimes to interact with the institution. love interacting with everybody in person, but some of our IT infrastructure can be a bit challenging. So we have had a grant in since March of 2024. And so I'm getting a little emotional about this particular award because it's very exciting, but CATSI had made sure we announced it internally once we found out last week, and we went out to the community after that. But just in the event that you didn't hear, we'll go over it briefly. And put some words to it, and I'm going to read the public announcement because I think it captures it great. Rome Health awarded $18.9 million state grant to advance health information technology and transform care delivery. I had shared last week, I think, that it was the last element on our journey to transform community-based healthcare into the future and garnered a lot of stability. Rome Health has been awarded this $18.9 million through the statewide healthcare facility transformation program 4 to advance health information technology, cybersecurity, and telehealth across its network. The funding will allow Rome Health to implement an integrated electronic health record, replacing 6 disparate systems currently in use. The new system will help providers spend less time navigating multiple platforms and more time with patients while improving care coordination and efficiency throughout the hospital and affiliated practices. I would add that our support services, financial services, our coding and documentation teams, our rev cycle teams, this will also help those particular workflows as well. The $18.9 million project is a major milestone in our mission to transform healthcare delivery and strengthen the long-term sustainability of care in our community. I wanted to share with everybody. With our new ICU, surgical services, women's surgical suite, and medical center already open, this health IT initiative is the final component of the transformation plan, as I said, we set in motion 5 years ago. I also shared we're deeply grateful to our state leaders for recognizing how vital this project is for the future of healthcare in our community. When the Commissioner of Health was here last year, when the elected officials have visited Rome, we have a lot going on. We have several grants still out there, but I was clear that if there was any focus that people could have for Rome Health, it would be this particular grant, and so grateful that people heard that. We express our deep gratitude to Governor Hochul and Commissioner McDonald for their continued commitment to strengthening healthcare across New York State. Their leadership in prioritizing investments that modernize health information technology, enhance cybersecurity, and expand telehealth makes a meaningful difference for communities like ours. The support structure ensures that Rome Health can continue building a safe, reliable, and connected system of care that meets the needs of our patients today and well into the future. I do want to share a little bit more that Senator Griffo has been a steadfast advocate for Rome Health and for the people of this community for decades. From his early days as mayor, as he continued leadership in the Senate, he has continued to champion investments that ensure Rome has access to the best care out there here. We are profoundly grateful for his unwavering support and for always providing a voice to the region. We are also grateful for Assemblywoman Buttonshaw for her support in helping to advance this project through the legislative process. Her engagement continued to ensure this initiative received the much-needed attention and part of a broader effort to help providers and for patients. And I believe I shared, too, that we have Nancy Levitt, our CIO, and Dr. Mike Attili, our Chief Medical Information Officer, who has already started to lead this project forward. Really proud that we had already started to construct kind of our dream and focus and needed workflows that we needed to articulate through the Rome Health voice. And those requests for proposals have already gone out to a number of stakeholders that kind of fit that vision. Not every IT vendor would meet our expectations, but certainly there's a few that we've already sent out what our vision is and would they like to respond. Now, rumors, hot off the press rumors. I have heard in the last 24 hours that people have said, well, has she already kind of predetermined the process? And does she, or the administration or somebody else, have they already decided what it is that we need? The short answer to that is no. We're looking forward to taking a process. I think I would just add to that, though, my previous statement of when you look at how comprehensive our network of services is and our size, not a lot of vendors can meet those needs these days. days to move onto a single platform. So the stakeholders are actually few and far between. And many of us who've been in healthcare for a while, we know some of them, we've interacted with them in school, if maybe people are new graduates or have been at other places. There are only a few that really work well with a hospital-based network of services that's multi-specialty. So there won't be a lot of options, but there'll certainly be a couple that we're working through with this request for proposals. So the next stage is to kind of announce that we have a timeline of around 24 months. It's pretty quick when you talk to people. So when stakeholders were giving us their feedback, they were saying, like, some people may not want to give us, their vision on how to be able to accomplish our goals because our timeline is pretty short. But Nancy and Dr. Attilio will announce our executive sponsor of the project as that's finalized. Will start to give us more information in the near future. But it'll be quick. 2 years might feel like it's far out there, especially those of us who are ingrained in all the systems, and it's a bit cumbersome, but it'll go by quick. And we want to make sure that we have a lot of engagement from all of us at every level of the organization, either through the selection process, experiencing the new opportunities, or adopting a new system. It's going to be one of those efforts that takes absolutely all of us. So exciting news. I have to admit, I was a little emotional. I think I did some flying leaps into people's arms and gave them.
I know Cassie did.
Cassie did.
Yelling down the hallway, oh my gosh!
If people haven't interacted with Cassie, she just puts her heart and soul into describing Rome Health in a way to be able to meet the grant expectations, but really describe what's happening here, which is pretty special. And so kudos to everybody for that, and looking forward to our next phase of this particular project. So that's somewhat hot off the press, and hopefully people have seen some of it, but wanted to make sure we went through the points. If you have questions about the announcements or some of the high level with the grants, certainly reaching out to me, to Cassie, to Nancy Levitt, or to Dr. Attilio is perfectly appropriate.
Or the mailbag.
Or
the mailbag. There's a reason for it.
Oh, Chuck, thank you.
That's right.
Putting that plug in there.
Little plug, always.
I forgot to. Thanks, Chuck. Well, without further ado, it's very exciting for me to be able to announce our special guest, just an amazing individual, kind of one of those rare people that you find that everybody that interacts with her speaks so highly. Very talented person. And I think I had said through email, and then when I saw her this morning, what an answer to prayer. I was really looking for another guest that we could go deeper with, that's a leader on the front lines here at Rome Health and in healthcare. And she had reached out to me, which I was just uplifted by, unbelievably, after she'd seen a couple podcasts. So without further ado, I'm joined with Lesli Fox. Welcome, Lesli. Hi. It's so great to have you here.
Thanks for having me. I appreciate it. It means the world to me to be able to speak about this, something that I'm so passionate about. So
yeah. So we're going to get to go right into that, I think, in a minute, of some of your service, even beyond Rome Health.
Yes, ma'am.
To people, to patients in just desperate needs. But before we go into that, do you mind sharing kind of what you do, your expertise, and why you wanted to be part of the podcast?
Absolutely. So I am a surgical technologist, certified surgical technologist. I've been at Rome pretty much my entire career. I've been a surgical tech for 4 years, so I've specialized working with Dr. Hall, Dr. Malika, Dr. Kenda, so all the big names over there, lovely people. Mm-hmm. But I was able to travel in my time over the 4 years also, so I've done a couple travel contracts, excuse me. I've been to Glen Falls, Binghamton, St. Joe's, and that's actually how I got introduced to our later conversation, the people that run Operation Walk. So
I've heard a little bit about Operation Walk. Let's jump right in. How did you get connected or engaged in that particular program and project? It just does amazing work across the world.
Yes, it is quite amazing. It has 13 different chapters across the United States. It started off in LA. I did a travel contract in 2023 at St. Joe's from January to August. And my primary specialty is ortho spine. I can do a little bit of everything, but my primary is total joints, hips and knees, along those lines. So I worked with Dr. Grinke's, Max, Seth, and Brett. I worked with Brett just a little bit, but I primarily worked with Max and Seth. Earlier this year, I would say back in February or March, Max had reached out to me and texted me. I hadn't seen him in probably about a couple years. So the fact that he even reached out to me after like 2 years since really seeing him or talking to him meant like a lot to me, because it was like had a lasting impression on him.
Yeah.
So he reached out to me, texted me, he was like, hey.
Lesli, you do that for so many. That's very special.
It's humbling, and it's, you know, you don't think anything, you're just doing for yourself and the community, and you're taking care of patients, and you don't think any more into it. You're just doing what you feel is right, I guess. Yeah. So the fact that he reached out, I was very I won't even lie, I cried when I got the text message, because I was like, this is amazing opportunity that he offered me.
Yes.
So he texted me and he was like, hey, we're planning our next mission trip to Ghana in Africa. Would you be willing to go as a tech? And I was like, I told my husband, I was like, what do I do? I'm like, what do I say? Wow. He was like, will you ever get this opportunity again? He was like, absolutely, take it and go.
What a great husband.
Yes, he is fully supportive of my career. If I tell him I have to stay late because I need to help out or something emergent came in, he's like, okay. So he's like the best husband ever and the best supporter ever.
Oh,
so
wow.
I appreciate him.
Wow. So, well, and what you're going to talk about, yeah, I mean, it needs a lot of support, you know,
Yes.
both at home and abroad. But so a mission organization.
Yes, ma'am.
To Ghana. And what was that experience like?
It was absolutely life-changing. I feel like we're very privileged over here. And to be able to throw out all your reserves, what we know and standard practices in the OR went out the window. Yeah. So, and even during our time over there, we ran into a bunch of little hiccups. So the sterilizers in SPD went down. So we had one of the techs that was there, he's been a tech for about 15 years, I believe, and he's a wonderful human being. He stepped up, took the trays that we needed processed and stuff for the following day, drove across the town with them to another facility to get them processed and bring them back just so we could be able to finish out the surgeries and get the care that was needed to the patients.
I've heard that. I've heard it doesn't matter what role you have. Everybody gets utilized to do anything that's needed, in the moment. Because there might be hiccups, right? I mean, going to another country, a separate team that comes over, and everybody just pulls together, and there's no task too big or too small for anybody to jump into.
And you have to rely on each other. This is all you have. And the teamwork that our team had was there was hiccups, but it was flawless. Oh, wow. Everybody had great communication. Everybody talked with each other. If there was a problem, it was communicated. There was nothing missed, you know. And it was an amazing experience just to be giving the resources that we had and being able to pull off what we did. Wow. Which we did 95 patients, and we did 110 joints in 4 days. So
that, Lesli, I think Chuck's got
That's crazy.
Yes, Chuck. And I think Chuck has some pictures. Lesli was gracious enough to give us pictures and to kind of draw us into the experience. But can you say that one more time? I mean,
4 days of work. We worked Sunday through Wednesday.
Yep.
Between 12 to 15 hours a day, and we did 95 patients and 110 joints. Most of them were bilateral joints. Oh my God. We did 17 knees out of the 110 joints. So it was long, grueling days, and they only had one air conditioner in there that was puttering around, but it was putting out as much as it could. It was working really hard, but it was just amazing. Like the power went out, and the response from the patients that we got, because we only did everything under spinals. So it was like get in, get out,
yes,
and move as fast as you can. So these patients, like, we were moving them to the stretcher after the procedures, and it was just, the first day was very overwhelming. I cried, I won't lie.
Yeah.
Because it was just, they were so grateful, and seeing them walking through the halls with the walkers, and a lot of them have lost a lot of their mobility because of sickle cell, because it runs really high over there.
Yeah.
And sickle cell attacks the femur, the head of the femur, quite badly.
Oh, I don't know that I realized that. Okay.
It causes a lot of necrosis, so that's why we did so many hips over knees. But the stories that you would go through and hear of these patients where they've lost family because they weren't mobile anymore. These people walk on their feet all day.
Wow.
Like, they walk to travel.
Yes.
That's how
Like, that's
they make
their livelihood, right?
Yes.
Yes. Okay.
Yes. Like, when we were there, we were on the bus, and there was people walking in between the bus with baskets on their head of like sodas, waters. Like, there was people with like steering wheel covers, like windshield wipers, and it was just really like eye-opening, because it's just like, I have never been to a different country before, so it was very eye-opening, and it's like, you stop and think, and you're like, holy cow, like, our medical system and everything along those lines, I don't even know how, it makes me speechless at times, because it's just like, we should be very grateful for what we have.
Yes. Yeah, we're so blessed, right?
Yes, ma'am.
And sometimes we lose track of that, because this is kind of the life many of us have lived. This is what we know. But when you have this opportunity to see and be with people and their lived experience and what they're kind of challenged with, I bet there was kind of like, well, just describe for me, I bet there was kind of like this kind of acknowledgement of how much we have and how blessed we are. But then in that particular setting, how much they have and their ability to kind of come together and see the world. And you'd said this at the beginning of the conversation, like the way healthcare is allowed to be delivered there, there's just, if there's barriers, they're taken down very, very quickly, right?
Yes, ma'am.
Wow.
Like, the sterility wise was like, I knew a big issue for me, because I pride myself in my work and having a sterile field and making sure everything's smooth, because it's like, I take my patient in the room as a sister, a brother, a grandmother.
Yes.
So I'm like, this is somebody's family member. You know, I pride myself hard in my work. It's terrible, but great. But
Wonderful.
It was like the trays, most of them had like holes in the wrappers, and like, over here we would be like, okay, we just grab another tray and go, but this is the only tray we have. Right. We have to take it. And out of all that, there was only one infection, but like, rather than that, everything was perfect. Good. It was flawless. It just mind boggles me how like they put all that together behind the scenes and then just got it to run so smoothly.
I'm so glad you went.
Me too.
Speaking of transformation, we use that word. Sometimes it's a little overused, but it's kind of very near and dear to me, as, you know, I've come here and really thinking through how could we think about healthcare differently, like post-pandemic. But on a personal level, I have heard of other people who've gone on Operation Walk missions that they've come back different, almost transformed. Can you share a little bit with us about that?
I would say, like, I came back honestly a different person. It humbled me so much, and like just made me want to pride myself more in my work and put forth more effort to be better at my job. Wow. So like to be able to go on something that life-changing and be able to actually come back and talk about it and explain about it, and it's so hard to put into words, because it's just like, so I don't even know how to describe it, honestly, because I know I did come back a different person. I came back calmer, like more relaxed, more open-minded, more free-flowing, like, okay, this is what goes, this is like speaking up whenever needed to and stuff. But I don't know, it was just so amazing and like so humbling. I know I'm at an honest loss of words for this, but it was just like...
I think your words are good, right, Chuck? And I think your expression says it all. So I'm really glad if people are listening, go back and maybe take a minute to watch, so you can see I know people are listening to the podcast in the car and such, but if you can, just to be able to see Leslie's expression. I think, Leslie, what it's reminding me of, and I think I talked about this briefly in a forum once. So before I came to Rome, I served in Catholic-based healthcare at St. Joseph's. And I remember learning about sacrificial service from the Sisters of St. Francis in the Newman community, and they would kind of talk through how, the ability to give beyond yourself actually motivates and energizes you in return. It's almost like you're taking these steps, like going to another country and you've never been to another country, and working in conditions that you've never experienced while keeping the incredible competency and mindset and knowledge that you have and expertise, but to kind of go beyond yourself. And then what that does is cause a transformation that creates more energy. The sisters used to kind of express that in a variety of different ways, the way they serviced, at least in healthcare. And then I remember going to a conference where a neuroscientist from a very different viewpoint, like from a scientific standpoint, was speaking and was talking about the same type of phenomenon, that within healthcare workers who are willing to give beyond what they thought they could ever give, like you're talking about, exhausting, emotionally draining, but coming back day 2 for another 12 or 15 hours and kind of being with people in some of their most challenging moments, almost has this reverse chemical effect in our brains and in our bodies, that we have even more of a transformation, that we have more energy. And
You're absolutely correct, because I notice, like, excuse me, thinking about it, you're exhausted over there because we literally left Thursday night. We got there Friday morning at 7 a.m. and literally hit the ground running. Like, we went to the church, got blessed, were thanked for coming over, doing our services, and then we went straight to the hospital after we dropped our stuff off at the hotel, got everything ready Friday, went back to the hospital Saturday, and then started working Sunday to Wednesday. And you're working those 12 to 15-hour days, but you don't even think about it. The time goes by so quick. You're just doing what you can. Open your trays, take your trays, set up, get everything ready to go as quick as you can, because we're doing 6 to 7 cases in one room alone, and they had 4 ORs, so 6 to 7 cases in each room per day.
Wow.
And it's just like, we had such a good flow, and everybody just worked so well together, and it was effortless.
Wow.
It was just like, our last day was supposed to be our short day, and it ended up being our longest day. We didn't leave the hospital until almost 9 or 9:30 at night, and it was just, like, amazing. I found myself again.
Oh.
So it was just, like, so rewarding, and then it made me realize why I do my job.
Yeah.
And, like, it was just amazing.
Oh.
I can't even think about, like, any other way to describe it, because I hope I get to go back again, and I'm even trying to do fundraisers maybe in the spring to raise some kind of money to put forth towards the
next operation.
next operation walk.
Wow.
So,
Well, Leslie, thank you for sharing your experience. Do you have any thoughts or recommendations for those of us that, are certainly in healthcare, experiencing healthcare? Is there anything you can pass along to us, the way we should maybe learn from that experience, or how we can be better?
I honestly would say step outside your comfort zone. I was so anxious because I didn't want to like fail or flop why I was there, because that was like so highly of the asking me. Step outside your comfort zone.
That was a lot of pressure, I bet.
Yeah, and I was like, they had been to Ghana actually a couple different times, or one other time in 2023. And so it's just life-changing on the aspect of like being asked, but like go out of your comfort zone. I was so uncomfortable like preparing and going through the steps, and I was like, oh my gosh, I'm really doing this. But like after I did it, I'm like gung-ho about it now. So like if it makes you uncomfortable and it's safe, do it.
Do it.
I
like, Chuck, that's awesome. That's one of the best takeaways, right?
Just do it.
Just do it. Step outside your comfort zone.
I know we like to huddle in our little boxes, but like if you can, like I get floated sometimes to 2 East and 2 North, and that's like doing PCT work, and I love the hands-on, the interaction, and you know, I was uncomfortable because I wasn't familiarized with doing the work down there on the floor.
Yeah.
But now the nurses come and see me and they're like, hey, how are you doing?
See,
so it's just like, step outside that comfort zone, do what you feel is right, do what you feel is passionate, like put forth all your effort into it and just do it. Yeah.
Well, Lesli, like I said at the beginning, you are universally respected, and that speaks to your character, and it speaks to how you live your life. And so it's not a surprise. You stepped outside your comfort zone and you did this. Congratulations. I mean, going on a missions trip and impacting that many people that I'm certain from your testimonial have likely been suffering for quite a long time and have stressors that we may not know, some of us, any idea about. So thank you for doing what you're doing. It's been a little while since I've asked this question, but Lesli can handle it. Lesli, what do you think, me, like if I want to be the best CEO that I could possibly be, certainly for Rome Health, what do you think that I could do better or differently to be able to keep serving our employees, our community?
I feel like the communication is very key. Just communication within the staff. You are on the floor quite a bit, which I highly respect, because being able to see you, acknowledge you, and know who you are as a person is wonderful in my aspect, like my eyes. But like, just keep the open communication, listen to what people have to say, where people are coming from, and with your degree and everything, like you understand, you know where the staff is coming from also. So you being in that position makes it easy to correlate, because you understand you're not just some random person.
Sure.
So just keep your open communication, keep your face on the floor, and be present.
That's great. Thank you, Lesli. That's making sure I have that in the forefront of my mind of how to stay connected, to your point. Are you ready for some rapid fire?
Ooh. Here we go.
Oh my gosh.
You know, we're getting some great feedback with this, and I feel like we've gotten to know each other, and so therefore I think others that are watching or listening getting to know you quite a bit. But these are a fan favorite.
Heck yeah.
Goodness. I'm going to like end up stuttering and be like,
I did too. If you watch or listen to last week's episode, there was a couple, and then like Chuck snuck a couple in there. That
Oh yeah, I surprised her totally.
Yeah, I was like, and then I
that
think
makes for the best podcast.
Exactly.
Exactly.
She gets it. She gets it.
And then I think I said at the end, I'm like, I'm so not an interesting person.
It's so untrue.
You like process. You're like, I could have did better.
You know, Lesli, you know. But so question number 1, what is your go-to gas station snack?
Oh, beef jerky.
Beef jerky. That is a good one. So
That's
you like
yeah.
protein.
I mean,
That's
protein.
good. That is
It's, like,
awesome.
heavy. Does coffee count though too? Because I weigh my options.
We accept everything in the rapid fire. Everything's accepted.
Okay, well then it's Stewart's coffee because I just tried it for the first time a couple weeks ago and now I'm addicted. So
I have
if anybody
not-
wants to get me a Stewart's gift card, I'll take it.
I love that. Shout out for the Stewart's gift card.
I know, right?
I had just heard this from a couple other employees. I was walking in and we were connecting, and I saw their Stewart's coffee, and I said, "Is that really good?" They said it's the best. Okay, times 3. So Leslie's the third employee that I've talked to about Stewart's coffee. Okay, have you ever won a contest?
Yes, I came in like second place. I was in Jamaica and it was a theme show song contest. So they played like 3 seconds of a movie song score or a theme show, and I won a bottle of rum.
There you go.
Now, do you like rum?
I do. The Jamaican rum is actually really good. I can't deny that.
Wow, that's a good guy. I love it. And I like that she said second place. Just second. I love it. But you got a prize, so it counts.
It's second, but I mean, any place is placed.
You're on the winner's stand.
Yes.
Your favorite toy as an adult?
Oh, man. I don't know. I would have to say the PlayStation that my dad left my kids.
Oh,
Because he passed away a couple years ago, so my mom gave the girls the PlayStation.
yes.
So I used to play when I was younger, but now the girls are starting to play and like get into video games.
Yes.
So there's a cooking game on there that I play. I like.
See, this is really good. I love how close we're getting to.
I know,
Leslie
right?
with these
See, rapid fire
questions.
rules.
It does. I mean, like it boosts the morale. That's for sure.
Yes, I have to
Everybody's
say,
human.
I have to say, I'm old enough to really have enjoyed Atari. So PlayStation is a skill set I don't have. Okay, keep it. We're going to continue. What's your favorite movie?
The Fifth Element.
Element.
okay.
That is an excellent one.
Yeah.
That's actually my husband's, one of his top favorites.
Or Drop Dead Fred.
Drop Dead Fred. Yes.
That's an old one.
Is it?
I'm loving this. Okay, great. Okay, last one. Your hidden secret talent.
And you have to do it.
I don't have a secret talent. I just would say that I am a decent softball player.
Nice. I
Like-
love
Okay, so we got a glove and a ball here. Hold on, we heard about that. And
I have a glove in the car. I can go get it for you.
see,
Gosh, I love softball. I think it's an amazing sport. Do you play often?
Not after having my kids.
Yeah.
But I did play like routinely, and then I can ride a dirt bike.
That is. I just learned how to ride a dirt bike.
Oh,
Yes. I can't. Like, are you a street rider? Like, do you know how to?
No.
Okay, me neither. I was very proud that I got to it and I got in first gear this past summer.
oh, nice.
Yes. Is it like an adult one? Because I'm doing the mini still.
Oh, you're doing like a 125, like smaller.
yes.
Yeah. No, I had a Kawasaki 250, and I learned when I was living in San Diego, in the desert. And then my 6-year-old races too. She loves it.
Wow.
Dad's a great dirt bike rider, and Papa's a dirt bike rider, so.
Leslie, we're getting seriously close to me looking up to you so much that I feel like I want to be you. Yes, like, oh my goodness, right? Like, that's the thing. And I love that it's your daughter. Does she do like the
Yeah, actually.
motocross games or like?
Yeah, actually, when I was in Africa, they had at Utica, Rome, a race for the kids. And if the kids race, my husband got to race. It was like if the kids race, the parents got to race.
Yeah.
So my husband got to race too. So, like, that's their bonding time. And
Sure.
like, she is like, if she rides her dirt bike and races and stuff, she has to clean her own bike. My
Yeah.
husband helps her. So
You're responsible.
being responsible and
Yeah.
stuff like that. So that's how I met my husband, is through dirt bikes. So
Well, on behalf of me and Chuck and Rome Health, tell your husband hi. And we are grateful for him and his support to you, Leslie.
Yes.
Thank you for being with me on the podcast.
Thank you for having
Appreciate
me.
you.
And AnneMarie, if you
Yes.
look in your drawer right there,
Yes.
I forgot to tell you, we've got something that we can, yeah.
Wow.
Yeah, I totally forgot about that. And I was like, I forgot to put them in
You
there.
get a podcast prize.
I get a podcast prize.
Yes, and you are
Yes.
so amazing. I think she deserves the two.
Absolutely.
Yeah.
Oh my goodness.
So these are catching good like momentum.
Thank you. I appreciate
Yes,
it.
of course. We appreciate you being on the podcast and spreading it. And I think I said this in the beginning, but I had been thinking, I literally was thinking, reminiscing, reflecting, praying about the podcast. How did the pilot go and what was the feedback? And I think I said this in the email. It was like that next morning, Leslie had emailed me and talked about what an important topic we talked about in this episode is. And so I know I feel energized by my time with Leslie. I hope you all did as well. In summary, we want to thank Leslie again for her time on the podcast and step outside your comfort zone. That's what she challenged us with her feedback and her learnings with going on a missions trip and certainly applying some of that transformation here at Rome. In closing, I just want to share with everybody that I think I said before, I was out in the community. I did receive a wonderful compliment from an elected official that had a family member that came to Rome in a very urgent, critical situation, and they were absolutely in awe by the care that was given to them through the emergency department. Most hours of every day, our emergency department's very, very busy, but we're so grateful for the team that we stay open, accessible, we avoid diversion at all costs, and what that does is leave us open for urgent and critical events to the community. And they were just absolutely wowed by the individualized care that their family member received, and they were just, again, in awe. So thank you all. Merry Christmas and happy holidays again. Thank you for everything you do and creating the best care out there here.